Next, we have a fantastic panel on putting the worthy in trustworthy AI. And we have a brilliant panel which will be chaired by Professor Shannon Valor, who is the Baillie Gifford Professor for Ethics in Data and AI at the University of Edinburgh, and also the Director of the Centre for Moral Futures, and also a whole lot of other amazing titles that I can't quite recall off the top of my head. But anyway, I'd like to welcome Shannon onto the stage along with our fantastic panel, which she will introduce. Come on up. Thank you very much. So I'm going to hand you over to Shannon, and I'm going to put this down here.
Fantastic. Thanks, Steph. Welcome, everyone. Thanks for joining us today, and thanks, as always, to the Scottish AI Alliance for allowing us to come and put on this session. We're really excited to talk to you about how to put the worthy in trustworthy AI. So this session is going to try to answer that question by taking into account the fact that AI is not a monolith. AI is not one technology. AI is not ChatGPT. AI is not even just all generative AI tools. AI does lots of different things. We have lots of different techniques and approaches to building AI systems, and they have very different risk profiles. They have very different benefits. They have very different limitations. And that means that those differences have to be taken into account when we decide how much we want to rely on them, whether they and the people who deploy them are trustworthy. So we'll get into the conversation. First, I'm going to introduce our distinguished panel here, and then we're going to get you into the conversation right off the bat by asking you to do some online polling with us. So while I'm introducing the distinguished panel here, we're going to put up a slide that includes a QR code and instructions for how to join the polling site that we will ask you to participate in shortly, okay? If once you get there you see a question, don't answer the question yet, because we haven't actually given you the scenario the question is based on. But at least you can log into the site and make sure you can get into it. So while you're doing that, I will dig into the fantastic expertise that we have here. So I will start to my left with Dr. David Robb from Heriot-Watt University. Dave has worked on UKRI, EPSRC, and DSTL-funded research projects, including as experimental lead for the human-robot interaction theme on the EPSRC Orca Hub project, which is about offshore robotics. Dave's post as a research fellow at Heriot-Watt School of Mathematical and Computer Sciences is currently funded by 3 national robotarian projects: DeMilo, which stands for Developing Machine Learning Empowered Responsive Manufacture of Industrial Laser Systems. I said that all in one breath. The UKRI Trustworthy Autonomous Systems node in Trust, and the EPSRC Human Machine Teaming for Maritime Environments Project, or HUME. As a philosopher, I particularly love that one. Dave's research focuses on the human side of human-robot interaction, including the psychology of how people and why people trust or distrust technology. To Dave's left, we have Bhargavi Ganesh, who is a PhD researcher at the University of Edinburgh, who I myself am very fortunate to work with. Bhargavi works on interdisciplinary and mixed method approaches for designing a responsibility framework for the governance of AI. In the past year, she's worked within the Bridging Responsible AI Divides program that I co-direct with Professor Eva Luger in the Edinburgh College of Art on a consultation for the Department of Science, Innovation and Technology. And she's also interned within the former Centre for Data Ethics and Innovation, formerly called CDEI, now the Responsible Technology Adoption Unit of the UK government. Her work has previously explored both the historical and philosophical dimensions of AI governance, and she's currently working on engaging with stakeholders to understand the practical challenges of implementing governance principles in AI. She's a member of the Edinburgh School of Informatics AI Applications Institute and EFI's Centre for Moral Futures, and is affiliated with the EPSRC grant on the governance of trustworthy autonomous systems, as well as the governance and responsible AI lab at Purdue University. And she's still working on her PhD and has already done all of those things. So she has been very, very busy. And prior to her PhD work, Bhargavi's research focused on the impacts of consumer finance policies on marginalized groups. And then last but not least, of course, we have Ali Shah, who is the Global Principal Director for Responsible AI with Accenture. Ali serves also as an Executive Fellow at the World Economic Forum and a board member at the Ada Lovelace Institute. He was previously head of technology policy at the Information Commissioner's Office and worked his way up over the course of 15 years at the BBC, culminating in his role as the BBC's former head of emerging technology and strategic direction. Ali holds a B Engineering in honors from the University of Sheffield in electronic engineering and in electrical, electronics, and communications engineering. So thank you all for joining us today, and let's get into the conversation. So here's what we're going to do. We're just going to give you a scenario first and ask you to, from your seats, give us just your untutored intuitions on this scenario and how you might think about it. So here's the scenario, and it's based on reality. So there's more detail than we can put in here, but this is a real thing that exists. In the United States, there's a complex data-driven algorithm called NARCS-CARE. It's widely used to flag patients at high risk of opioid abuse. However, the algorithm has in some cases led patients without any history of opioid abuse to be denied pain medication by their clinician or pharmacist, who do not want the perceived legal risk of overriding the NARCS-CARE assessment. Now, opioid abuse costs over 100,000 lives annually in the USA, and although only a portion of those are prescription-related, NARCS-CARE almost certainly saves lives. However, the algorithm has drawn criticism over its relative opacity. While clinicians receive a dashboard containing some information about key risk factors from prescription monitoring data that drive a patient's score, it's unclear exactly how the algorithm uses the many non-prescription data sources that the company claims to be able to draw from. This includes information from the criminal justice system, insurance claims data, and even information about how far a patient has traveled to receive treatment. And patients, notably, don't receive an analysis of how the score in their case was reached. So if they are denied medication by their clinician or their pharmacist or hospital, they may not be able to learn why. So, first question. If you go to your app, do you see a question? Yes, it should look like this up here on the screen. If you were a hospital patient in the USA, would you trust NARCS-CARE? You have the option of yes, no, or unsure if you would need to have some more information before you could guess. So go ahead and throw your answers in there now. We'll give it a minute for everyone to get in and respond. Okay. Well, it looks right now like no is clearly in the lead, with unsure a clear second, and yes, a very marginal figure. Okay, that's interesting. Now, second question. If you were a clinician in the USA, would you trust NARCS-CARE? Yes, no, or unsure? Interesting, okay. Let's give it another second, see if anything changes. All right, it looks like a lot of you are unsure, so maybe we can dig in during the conversation to what you would need to know in order to even guess whether, as a clinician in the United States, you would trust this tool. And remember, you'd be trusting it enough to tell one of your patients, no, you don't get pain medication today, right? So the stakes are pretty high here. Okay, so we're gonna do one more scenario, and then we're gonna jump into some discussion. So the second scenario is this one. We're no longer talking about NARCS-CARE. Since May 2023, this is also based on reality, one I would suspect more of you are familiar with. 5 autonomous buses have been crossing the Forth Bridge. carrying up to 10,000 passengers a week in a pilot of the technology called AB1 as part of a wider project called CAV Forth involving Stagecoach East Scotland, Transport Scotland, and researchers at Edinburgh Napier University and the Bristol Robotics Lab. During the pilot phase of the AB1 service, a human safety driver will remain in the cab at all times. A safety case for the project was reviewed by independent experts. Okay, so remember, this project's already been running since May of last year. So here's a question. Let's go to the next option. Do you trust the AB1 service enough to be a passenger? Maybe some of you already have. But given the opportunity, would you ride the AB1 across the Forth? All right, okay. So here we have a lot more confidence. We'll give it another second, but I doubt that's going to change drastically. Okay, so about 70% of you, maybe more, would trust that system enough to put your life in its hands, as many already have. All right, now here's an interesting question. Let's go to the next, and this will be the last one before we begin to kind of dig into this with the panel. If you trusted enough to be a passenger, so those 70% of you that said yes, what makes the AB1 service trustworthy in your view? You should be able to have an open text field where you can enter a sentence or a couple words. And if you're among those who still wouldn't trust the AB1 service, what would it take to make it trustworthy for you? Oh, this is cool. See, we did not know how this was going to look when it came up, and this is great. So yeah, keep entering your thoughts here. We'll watch the word cloud form. Pretty soon these words are going to get too small for my old eyes to read, but notice the dominance of human, right? Right in the center there. Okay. Let's cut it off so this thing stops moving for a second, or else we're all going to get nauseous. Oh, still moving. Okay, all right. Human oversight, human drivers, human safety, right? So that seems to be a really critical piece here. But we see a lot of other interesting ideas, and maybe some of our panelists will want to pick up on some of these themes. Okay, so we'll also have some time for audience conversation. So we'll dig into maybe some of your answers about these questions when we get there. But first I want to hear from our panelists what your responses are maybe to some of the judgments that you've seen about these two cases. What do you think that highlights that we might need to pay attention to? So for example, with the first case, we saw a pretty interesting difference between how people thought they would respond to NARCS care as a patient and how they might respond to it as a clinician. If you're using it as a clinician, does that necessarily mean that you trust NARCS care? Might you be using it even though you don't necessarily trust it, right? So let's talk about the scenario that we started with first, and then we'll come around to the AB1 responses and see what you want to say about that. So what strikes you so far in the first case? Yeah.
I can go. Firstly, just to say, Baroness Honora O'Neill wrote extensively on trust and trustworthiness, and one thing that really struck me about her writing was that she said trust is a leap of faith until you can demonstrate trustworthiness. So firstly, thank you to everyone for the leap of faith in joining this session and staying till this late in the afternoon. Appreciate that. But I think the first example sort of really illustrates that point. I mean, Shannon, you constructed the question to really create some tension because there's very little information about how the algorithm was working. There was opacity there. There was very little information for those who were being impacted, being provided by clinicians, but also for the clinicians themselves. So I think really until you have more insight into what is really happening there, what the results are, where the results are maybe negative, what are the reasons behind that, I think it's really difficult to make a judgment and then to have some trust in that process. And I think in a week where Daniel Kahneman has passed away and has shown us through his research that we can't necessarily trust our intuition, we need to really be careful about the process, or at least ensure that we're evidencing the process around decision making. Yeah. I think that first example didn't really do that, and that leads to the sorts of results that we're seeing maybe through the audience poll.
Yeah, that's great.
I'll add to that, that I think we can think about responsibility here in the sense that if you're placing the responsibility in the clinician, you would expect that that clinician would have all the information needed to discharge that responsibility. And it strikes me that part of the reason why you lack trust in this situation would be that the clinician themselves, despite all their training and domain expertise, cannot necessarily fully discharge their responsibility. They don't necessarily have control or full knowledge over the system. And so I think this is something that we probably think about more often than not in the context of trust.
That's really important because what you're highlighting is that trust isn't just between a human and a technological artifact, right?
Yeah.
Often our trust in technologies runs through other people and other relationships. And we place trust in our clinician and we trust them to use their technology appropriately, right? And then there's the whole governance structure around it and whether we trust the institutions that the clinicians have to rely on. So yeah, these are really complicated networks of trust. Dave, how does that strike you as a researcher on the psychology of trust? Did the results surprise you? Do you think there's more that we should bring out here?
Well, not particularly surprising. In our first scenario there, we had these people's impressions of whether they would trust as a patient and whether they thought the clinician would trust. We could see they thought there was likely to be more trust for the clinician, and obviously nobody was thinking as a patient they would be trusting the system. So the key differences there, I think, was one of the major factors in what allows people to trust in robots and AI is the transparency issue, as you were mentioning, Ali. You mentioned opacity. Well, transparency being the opposite of that. So from the patient's point of view, we were seeing that they had almost no transparency, so there was no information for them to go on, and not surprisingly, they were not, you thought that as a patient you wouldn't be trusting. But we could see from the scenario that there was a greater degree of transparency there for the clinician because they were getting a dashboard which would give them some insights into the factors that were contributing to the score. Therefore, we would think that, and probably rightly so, that the clinician might be putting more trust in the system because of from their point of view, they were experiencing a greater level of transparency. So in terms of factors affecting trust in AI systems, that's one that's right up there is the transparency of the system, I think.
Yeah. So let's look at the second scenario where we see a much stronger degree of trust, at least in this kind of intuitive quick judgment, right? I mean, maybe if people had to think about it longer, they might judge differently. But it looks like, right, there's a kind of strong intuition here that's linked to the presence of a human who's in control of the system. Is that a model that works for all AI technologies? Or is that something that people can always use as a measure of whether they should trust a system, whether it's trustworthy? You know, how close a human is to being able to intervene, for example. Any thoughts on that?
Well, can I go?
Yeah, please.
So another major factor that's been found to affect people's trust in systems is there's not everyone's different. So not everyone's the same in terms of their trust. There's differences. There's individual differences in trusting outlook and attitudes. So it's not necessarily a dichotomy, but you can maybe cluster people. There are some of us take the view that okay, it's a computer giving the decision, and everyone trusts computers is their viewpoints, so that perhaps they're seeing it as there's less bias in there. Mm-hmm. So that's the sort of a technology trust angle. But there's others of us take another viewpoint on it where they would prefer to trust something if there's a human more involved. Feeling that they're being, if there's a human involved, they're isolated from perhaps the arbitrariness that's involved in a artificial intelligence decision. So there's these two angles, and it all depends on our life experiences and our personalities as to whether we're in one or the other. And they're not necessarily permanent, these these attitudes, I guess, over our lives we can move, but it does affect how we look at things. So it's an interesting one. These things can be measured. We've got questionnaires can measure the cognitive side of it, but as Ali was pointing out, of course, we've got two ways of thinking. We've got, from Kahneman's work, we've got the fast thinking, where we've make a decision we're not even aware. That's our instinct, our intuition, and we've got our slow, thoughtful, cognitive process, which secretly, without us realizing, has been biased already by our intuition. So our cognition and our way of thinking is going to, we're affected by our two different ways of thinking, which is interesting.
So I'd like to ask, on the back of that, since both Bhargavi and Ali work in different ways on AI governance, how AI governance can be a tool to help people have maybe better intuitions, or maybe be protected from uninformed intuitions that might lead them into danger, either by over-trusting a system. For example, you mentioned that people might think that a computer can't be biased and therefore might instinctively trust it, and yet we know that many types of AI systems will actually not only pass through but even amplify that biases that are in the training data, right? So these systems can in some cases be more biased than we are. So how do we use AI governance to help people avoid that sort of error, but also avoid the other error, which is undertrust, where we might have a bias against these kinds of systems despite cases where they might be safer, they might save many more lives, they might allow us to do things that we ought to enable.
Would you like to go first, Barbara?
Sure. I guess I'll start by saying one thought I had on the previous question as well is that whether there's trust, the difference between trust and trustworthiness when it comes to a human in the loop. And we've kind of talked about this in the research that I've been working on, but that just because you have a human there doesn't mean that they are able to actually, or that you should trust that human, because there's a literature around this, a great paper called The Moral Crumple Zone, this concept that the person who's being asked to take that responsibility is just absorbing all of the blame potentially for something that they cannot control. And so again, I think it's important to consider that, we are happy to say that there's a human there and then we now trust the system, but that may not always be, may not be a trustworthy kind of environment. Additionally, kind of thinking about governance, I think transparency is one aspect of it, but ensuring that the transparency actually matches the person receiving that information is a really important part of this work that I'm sure Ali has much more experience and can talk to as well.
Well, I'm really grateful you went first because I can build on those amazing points and what you were just really describing there around who is the receiver of the decision-making or the accountability for what is happening, I think is something we should really talk about. In those two examples, let's take the first one. I think we really need to deconstruct this notion that you go straight from algorithm to clinician, and that is the only mechanism through which we should judge whether something's going to work or not. I think in that example, I'm not a medical clinician or work in the medical field myself, but I would imagine there's an ethics board. I would imagine that there are others who are evaluating the fit of that system for that purpose. There should be, if there isn't, there should be assessment of how often is this, or the false positives or the false negative rates, what did those teachers, what feedback is there from impacted users who are receiving the medication or is being held back, and really thinking through, is this the only vector, is this system, this algorithm, the only vector for making a decision making? I think if it was the only way that decision was made, I'd be really concerned. So if I'm one of those minorities who deserve medicine, but it was held back, what other recourse do I have to be able to access treatment? So I think really thinking through within the context of use, what is the appropriate governance structure? I think that's the first thing. It's very much context specific. And if I just pivot to the second example, I mean, what do I trust in that example? Well, I might trust that the algorithms underpinning that process will get me from A to B, right? There's a reliability that's been tested and worked out. It's a pilot, they've tested that it will work, like my sat-nav might get me from A to B. Well, some of us might remember the days of TomTom and Waze and Google Maps and all of these systems, and occasionally your sat-nav would take you to somewhere where you didn't want to go. And so I think, we've seen improvements in that happening. I think I might also trust that there's been assessment of how many times it went wrong. Did it do crashes? Were there other issues where the safety driver or the other person had to take over? Perhaps based on the information you gave us, Shannon, what I can't trust is, was there consideration of what this means for existing human drivers, right? So, the staff and the workforce, for the people who are having to work in this environment, I perhaps can't trust that understanding because that's not been revealed to me.
Yeah.
And I think part of this process around what's the right governance structure has to be to start to deconstruct this notion of trust and trustworthiness into what are the attributes for good governance? Is it reliability? Is it safety? Is it utility? And be really mindful of what those are teaching us. And we should separate out, and maybe this is a point for later in the discussion, but I'll mention it now. We should separate out utility, demand, need from whether this is reliable, safe, trustworthy, and something that we can feel confident in. And I think those are two important dynamics to manage, but I think it's important that we have clear sight over what they each individually mean.
Yeah. So we actually are a little short on time today, so we did have another polling question we were going to put to you, but I think actually a more useful way to spend the remaining time in the session is actually to open it up to the audience for the thoughts that the conversation so far has sparked in you. So let's go ahead and ask you all to jump in and ask the questions that are burning on your mind about how to assess whether these systems are trustworthy. And maybe you can give us things we haven't yet thought of in terms of what makes systems trustworthy for you. Who has a question? Yes, right up here. And then for those online, I also have the Slido here. So please put questions here too, and I'm happy to.
So some people in the room might find it repetitive because I've talked to them about this already. But I feel that there are systems of information all around us that we implicitly trust. So the example that I gave to somebody else earlier was that when you walk into a building, nobody actually checks whether the building meets regulation or not. Nobody's a civil engineer, nobody's an architect, right? You just implicitly trust the systems of governance, of planning, of design that make the building secure. Nobody checks a doctor's degree before you get them to check you up, right? So is there possibly an analogy that can be drawn from maybe the early areas of these fields and whether people trusted doctors or trusted this newfangled material called brick at some point? And is artificial intelligence really that different? Is it a different of degree, or is it a different of kind, or is it AI's pretenses to being conscious or being human-like that caused this kind of anxiety? Oh, can I trust it? Can I trust it? We don't ask it of anybody else. We don't ask it anymore anyway. I'll stop rambling now. Thank you.
Who would like to respond to that?
I can take a shot, and you can feel free to jump in as well. But I think one of the areas that we have to think about is that, I'm thinking about history of technology in my research. And like you said, we had these new technologies that were not initially necessarily trusted. I thought about steamboat accidents in the 1800s. So, personal travel was not really something that existed to a large degree. And people still wanted to get the benefits of that technology, but they were exploding all over the place, and people were like, we don't trust this, it's not safe, right? And so the government intervened, and there were standards, there's professional associations, various different layers of governance that were needed to ultimately imbue trust in the system and to bring, the economic advantages. I think that we are facing a similar problem now, but the difference is actually, I think we might want to ask the question, why don't we trust AI? Like, what is it, as you said, there's so much we take for granted that we trust in this building because we have building standards and all these different associations and governance layers. What is it about AI that feels like the Wild West that we actually distrust it? I think we should ask that question. And I think part of that is the fact that the conversation has been dominated by a few large companies that have really, lost people's trust in the use of AI. They are the developers, they are the deployers. There's tons of monopolies. So there's these kind of political economy factors that I think are really driving a feeling that technology is not really being developed in a way that is thinking about questions like safety, et cetera, at the forefront, right? It's more profit driven. And so I think that's where we see some of this coming about. And also AI being rather general purpose means that it's in various different parts of our social and political life in a way that we can't necessarily opt out of, right? Just because we don't trust it. So I think that would be kind of my wide-ranging answer to that.
I've got a question here online that I think is a really interesting one. So the questioner asked, do you think we can get to a situation that AI is trusted without needing to know how it works? What do we need to put in place for this? And I think that's an interesting question because AI is not a technology that it seems reasonable to expect every citizen to have a deep understanding of all the way down, right? So, and as has been said, that's the case for lots of technologies that we trust without knowing how they work. So what are the limits here for wider publics in terms of how much do they need to know about how AI works, and what can be done maybe to relieve some of the burdens of people to do their own research and make these judgments for themselves?
I mean, you're looking towards me, and what I'm going to say is I kind of want to reframe your question slightly,
Please
Shannon.
do.
So I think just sort of thinking back to my time at the ICO, we did some work with the Alan Turing Institute around providing guidance on the use of personal data in an AI context and around explainability. And really our guidance was that you need to think about explainability in multiple different ways depending on the stakeholders that you're trying to reach. You know, there's technical explainability, but there's also how do you just help users to understand what is happening? And I think, again, it really comes down to the context of use, but also the context of the stakeholder group that you're trying to communicate with. And in riffing back on your question, I think part of this is about really understanding in this ecosystem that we're describing, somebody needs to have accountability for the operation of the system, and that accountability will almost certainly come with an expectation of understanding around how that system is delivering the impacts it is delivering, which leads to a question around, well, can we explain how it's working? And that might not necessarily be a need to technically explain how it's working in certain contexts. Certain types of models are difficult to explain how they work technically, but overall the impact needs to be really well understood and an assessment done around is this impact within the norms and values and legal structures and compliance requirements and just what we feel as a society is appropriate. And when you're thinking about how these systems might impact our citizens, it's really important to also understand the trust that we might have in AI varies depending on the context of those citizens. University of Queensland and KPMG did a survey where they found that I think 60% of citizens don't trust AI writ large, but that varies depending on the sector and the context of use. So there's more trust of use of AI in healthcare, but less in recruitment, for example.
Yeah.
And because of that variation, I think different governance structures are needed to be able to respond to that. So where there is perhaps a higher impact if things go wrong, we may need more robust governance. Where there is a lower risk around the use cases, we may have more flexible governance. And again, as somebody who worked in regulation for a number of years, I'm a strong advocate for stronger regulation, but also a strong advocate for broader governance that really allows us to navigate this rapid development of this technology.
Yeah.
I think that's one of the key things that we have to sort of design for in this process.
Yeah. I think we have time for one more question from the... Oh, thank God. We had a conversation earlier about how much time we had left for the session. And
I thought we were back
We've got
in the
about 20
hour,
minutes.
but I realized we started at 15:15, so you're all good. Sorry.
Excellent,
The clock
excellent.
says 20 minutes, I think.
21 minutes.
Okay, yeah, well,
Sorry, that was my phone. Sorry.
no problem. I was told to stop at an earlier time, so I was rushing us through,
I thought we were finishing.
but now we're...
No, wait, sorry.
We can relax.
I love it when we get more time back. All right, so we've got a question there in the back.
Thank you. Just picking up something that's been mentioned in the last couple of conversations, I wonder if this idea of a professional body for AI would be helpful and how you think that could work.
So, as someone who works with technologists and roboticists, has there been much conversation about this in the circles that you run with?
Nobody's asked me to join a professional body on trust. But I could see how that might help in the area of regulations.
I mean, there are professional AI organizations. There's AAAI. There's the IEEE, which is the society that it essentially organizes the professional community of software engineering and electrical engineering, kind of brings it all under one big umbrella. And those professional organizations have tried to develop resources for people working in the field to meet the expectations of trustworthy AI. But I think there's a lot more work to be done in this area. It certainly doesn't look anything like what you see in, let's say, other safety critical fields like medicine, right, where there are very clear licensure and certification requirements and certain kinds of accountability that we don't see in the software industry. Ali?
I think it can always feel like jam tomorrow in terms of what we need when there's such rapid development of technology, right? There's never enough of what we need to realize those benefits that the minister was talking about this morning, but make sure that the harms are not realized. But I think let's take some examples that are food for thought. Under GDPR and data protection law, the requirement for a data protection officer is there. So there's an accountability within an organization around how personal data is being used. I think the IAPP, for example, has been developing a program for privacy professionals to really become also really aware and understanding of what the responsibilities might be in the use of AI technologies. Just today, I think, I need to double check this because I saw it sort of pop up on my phone, but I think the VP in the US, Kamala Harris, has issued a notice saying that actually there's a whole range of new requirements for federal agencies, one of which is the creation of an chief AI officer. I absolutely want to verify that is the case, but if that is the case, then that's an example of promoting clear accountability. I think standards bodies are really starting to accelerate in this space, working in different ways. You know, the UK AI Safety Institute, what NIST is doing in the US, the Monetary Authority of Singapore, all really promoting different approaches to trying to develop standards within this. And when developing those standards, what comes next around that, and wrapped around that is, well, who will understand this? So how do we professionalize the various different constituents in the value chain, the supply chain? And I'm trying to avoid the consulting language there, so I've been in consulting for a couple of years, so maybe it's creeping in. But what we mean by that is both those who are developing products and services. We had an exercise next door about how would we design features in products to deal with trustworthiness and trust issues, but it's also those governance specialists who are there to evaluate risk, assess what the impact might be. So how you professionalize them and give them more structure. I mean, from my own organization's perspective, a lot of what we do is around really creating structure for what type of skills are needed within that sort of, accountability chain, whether it's the skills that C-suite and leadership need, whether it's what data scientists and engineers need, for risk professionals, but also those who are really speaking to human beings, citizens, customers, consumers, and saying, how are these systems actually impacting you, right? Can we gather that feedback and really understand what we need to do? We wouldn't be here today on this stage and in this room having a conversation if it all worked perfectly. It does not. And I think the pace of some of this development means that how we professionalize is actually going to be a real challenge. I'm an engineer, I'm not chartered, but I'm an engineer. And in my original field, it's fairly straightforward to achieve chartered status. I should have just worked harder in those early days and gone for it. But you could go through that process. I think what does achieving an established standard in AI competency look like for different types of roles, I think is a big area of development that we need.
I'm going to just add one last point, which is that there's a great paper that kind of looks at the engineers at different companies and asks them, like, if they had an ethical question, like an ethical problem with something they were working on, what could they do about it? And what they find is that actually, only if management cares about that problem are they actually going to be able to do something about it. So I think professionalization is limited in the sense that, you know, I don't see it as a place where there's a lot of power right now. Like, I don't see engineers having that kind of power in this current environment. There seems to be a lot more management-driven, higher level kind of company, you know, profit motive-driven ideas that I don't think that engineers are necessarily being prioritized in that conversation and their concerns. And I would add to that that I work with other PhD students, and I frequently hear them talk to me about, you know, you're working in ethics. What's an ethical company I can go work for? Because I'm excited about technology. I'm excited about, you know, computer vision. I've been doing this my whole life, but I'm scared to go work for, you know, one of these companies because I don't think my thoughts about ethics are going to be prioritized. And so I think it's really important to flag that as well.
I think one thing that I thought of as you were speaking is I think of Boeing, right? Mm-hmm. And I think of the engineers at Boeing who have been chafing under a management structure that they say has not prioritized their safety concerns in the way that was the norm decades ago, right? And we see the real economic and potentially human cost of that kind of degradation of a safety culture, right, where the balance of power gets shifted away from the safety experts towards the people who have other priorities. And what that made me think of is a question that is here in the online Slido about how can institutions that have lost public trust in their services, and here the questioner says through AI use, but we could even think of other ways, right, that trust has been lost, still harness AI or technology while regaining some of that trust back. So we might think about things like the post office scandal here in the UK, or we might think about the devastating case in the Netherlands where the use of an algorithm to automate child benefits fraud detection absolutely destroyed innocent families, to the point that in 2021 the Dutch government had to step down as a show of shame over this particular incident. So, it's easy to say that governments need to be accountable, that companies need to be more accountable, but how do we allow AI to develop and flourish when people increasingly are scarred by institutions, companies that they feel have abandoned the duty of care to the public? How do we get that trust back? Or do we need to sort of slow down the adoption of AI in certain sectors until organizations and institutions can prove to publics that they're worthy of that trust?
I mean, Shan, you know this. I was pausing to allow others to come in because I could just talk and talk on this one. So,
Sure.
So cut me off as soon as you get bored.
Yeah.
I think let's take just aviation, right? I would imagine most of us still have a degree of trust to go and book a flight. Maybe we shouldn't because of carbon impact, but we would get on and still assume that overall it's going to be reliable. But for certain companies like Boeing and others where they've had issues, all of a sudden they suddenly have to do a lot more to prove and regain that trust, and I think that was your central point. I think with the AI context, part of this is also, again, really thinking about what level of transparency there has been around the way that safety culture, that reliability culture, that competency culture, the culture of accountability, and whether accountability is really delivered to those who are being impacted. How much can you really evidence that process, right? And I think really having the evidence for that process to show that actually there have been these mechanical is the wrong word, but these structures in place to enable a culture where there is real understanding of the impacted user and what that might mean for them. I think that becomes important. Even within that context, can things go wrong? Mm-hmm. I think absolutely they can do, and especially when we're dealing with probabilistic compute technologies, right? Based on structures where you might have reliability for a certain percentage of the time, that can maybe mislead you into thinking that this is always going to be 100% operating the way that you think. You have to be cognizant that that's not always going to be the case. So how do you build some confidence around that? I think partly it is about those structures, but being ready for those moments when it's not working. So again, where are the checks and balances to make sure that if something doesn't work the way you expect it to, what was the impact on the end user? And again, really placing those users, those communities at the heart of that governance structure, I think is the way that you both gain trust in the first place, but also if you lose that trust, the only way that you have a fighting chance to rebuild it.
I'm going to add one really quick thing, which is that I think it'd be good to know why are we using AI in the first place? What is the thing we're trying to optimize for, right? I think that would also help with trust. We end up in a situation right now where there's a lot of under-resourced things like the NHS, for example. And if we're saying, oh, we're using AI because we don't have enough people and we want to make up for that, is that really going to generate trust? Or is it, we have to think about what is the motivation for using AI and be more transparent about that and how that's actually playing into the decision-making around it.
Yeah, absolutely. So we've got some more questions in the audience here. Let's go in the back. Yeah. White sweater, glasses, yeah.
Hi, my name is Yasmin Ibison from the Joseph Rowntree Foundation. I think it's just picking up on that last point, really, and thinking about, are we focusing too much on the tools of AI and making them trustworthy, and should we be instead directing our attention to the places, thinking about public sector use of AI, for example, where that is being used in places like welfare and borders and policing, where there is inherently a distrust between the state and the citizens already, thinking about claimants of benefits. I'm talking about the UK context, talking about people at borders, talking about our relationship between citizen and state and policing. And should we instead be trying to focus on trust in those systems rather than focusing on the AI tools? Because I think there potentially is a correlation between where we're choosing to embed tools in parts of systems that are inherently distrustful. Does that make sense? Hopefully.
Yeah, I think that's very clear.
I think I take your point about the society wrapped around the system, but there could be an engineering angle on it, in that if we do strive to engineer a better, for example, transparency into these artificial intelligence systems, then despite the opacity or the complications of the social system they're involved in, for example, in justice systems, using AI to help inform sentencing, that kind of thing. If you've got robust, for example, transparency standards, there's an IEEE standard on transparency and how you can engineer, or what you should be aiming for and how you can define transparency in an AI system. So if you have robust rules and structures in the engineering to make it transparent, then that will fight against the tendency for opacity that there might be in the institutions that your AI system is informing in some way. I don't know.
Yeah, and I think really thinking ideally, it could make certain black box decisions more open, like, things that we didn't know about that were going into the decision making, and I think that's an aspirational lens towards this.
Yeah, I think this is, a conversation that we could have for a very long time. We've got 5 minutes remaining in the session. We've got one more question here that I'm going to take in the audience, and then I'm going to ask all of you for some final takeaway thoughts.
Thanks very much. I'm John Fitzgerald from SCDO. One thing that really struck me, Gabby, when you brought in the point about human in the loop as a moral crumple zone, I thought that was a very powerful point, and it made me thinking about the danger of companies or institutions saying, well, look, we've got a human in the loop, so you've got somebody who can hold your hand while the bus crashes, or you can remonstrate with them when you don't get the treatment you need. And what I was thinking about there was that danger of organizations going for the quick and easy, like superficial, look, there's a human in the loop, don't worry about it. And I wondered if there's a point about emphasizing the need for trustworthiness to be a harder standard to meet, and people need to do that with a bit more rigor than just having somebody sitting in a corner saying, well, there's a human there as well.
Yeah, and I think this is also a question about what kind of authority and power in the organization someone needs to have in order to have the responsibility appropriately located with them, right?
I know time is short, so just a couple of quick comments on that question. I would agree with that, and I think our own research shows that if you apply a responsible approach to the development and use of AI, and I'll consider is it the right thing to do in the first place before you even then sort of explore how to make it more reliable and safe, etc., it could add up to 10 trillion plus to the overall benefits on top of the trillions and trillions that everyone's projecting, right? These numbers are crazy numbers. I don't know how to make sense of them, but big number if you really approach it from a responsible way. However, in the surveys that we've done, 95% of workers, while they would say that they really see the benefits of generative AI, for example, the biggest issue that they have is that they don't trust their own organizations to do the right thing in terms of the outcomes and impacts to everyone. And so I think, to really gain those benefits that businesses might want to try and move quickly, part of it is about bringing everyone on that journey, employees, stakeholders, customers, citizens. And I can give you just one quick example from the day-to-day work. I have really seen a shift in the last 3 to 6 months around, boards, CEOs and others really asking, what's the long-term impact of this, right? How do we really start to design and build for the longer-term future, where we will need to really think about what those structures are that we need to put in place to demonstrate trust and trustworthiness. Now, the motivations for that are a multitude, and we haven't got time, but it might be around compliance worries, it might be around brand impact, it might be differentiation in the market, this helps us grow, this might shrink our business. There's a range of different motivations. But there is this central conversation starting to happen now to say we really need to think more long-term about what it might mean to introduce this technology both into our businesses, but then into the general public and our day-to-day lives.
So I'm going to ask you each to close with one thought for the audience. And one way you might approach it is if someone in the audience is thinking about either deploying an AI tool and maybe it's a specific kind of AI tool like generative AI, right, that has a special kind of risk profile associated with it. If someone's thinking about employing that tool in a way that they or others are going to rely on it, what would be one question you would want them to ask and be able to answer before they move forward with that idea? Yeah, please.
So my advice would be, a major factor in trust is your perception of your vulnerability in a situation. So ask yourself, in what way am I vulnerable to the decisions of this or the actions of this AI system? And use that as the number one feed-in to whether you're going to trust it or not.
Excellent.
I'm going to flip that vulnerability on who is the vulnerable person who could be impacted by the use of the system. I think which group is most likely to potentially suffer kind of the ill effects of it failing. I think that's something to consider.
So vulnerability, and?
I mean, I love that. That was partly going to be my point about really thinking about who's being impacted. But let me flip it again then. I think we shouldn't be asking what's the one question we can all ask and use that to drive forward. I think collectively we should be demanding more agency to address and rebalance the power dynamics in what we're seeing so that we can put in place the right structures for us to understand what is the right governance needed to allow us to maybe use AI in really positive ways in certain circumstances where it could save lives, where it can deliver other benefits. But also the agency and power and governance that we need to really address those questions around where we might not want to use AI in certain circumstances. And that involves everything from really having an approach at government level, within regulators, within standards bodies, within industry, but also with civil society and really engaging. I mean, we had a great panel with the kids earlier on, really engaging those who will be impacted by these services, both now and in the future, to be part of that design of that governance structure. So not quite your question, Shannon, but just a final thought.
No, I think it's a really important closing point is to make sure that the people who ultimately are vulnerable to these systems get to design the kind of future with AI that they want and that they're willing to move forward with, as opposed to having it imposed and then having to adapt and cope. And in a democratic society, we clearly ought to have a voice in shaping the future that we and our children enter into. So let's continue to demand that. Thank you all for your fantastic contributions to the conversation. Thank you all and those of you online for contributing your questions. Please join me in thanking our panelists in particular for joining us here today.